46. The coronavirus pandemic separates families long before they lose a loved one. And in almost all cases, treatment forces self-isolation. For many patients, the only faces seen are nurses, doctors, and hospital chaplains. CBS 46's Brittany Edney spoke with one tasked with comforting patients who ask anyone who will listen, "Why me?"
The reality is some coronavirus patients are dying in isolation, and their friends and family aren't getting the closure they deserve. Everyone is cheering on frontline healthcare workers, the people tasked with saving our sick. A less publicized position is the person there to comfort their sorrow.
They feel very lonely. They feel very isolated.
Meet Chaplain Kim Schmidt-Holman. When families can't be by one's bedside, she tries to fill that void.
So a lot of them talk about how the staff has really become their surrogate family, but it's still very hard to have that separation.
Even without providing the traditional human touch.
ICU was always a little extra crazy.
And while covered in PPE.
We are trained to take barriers down, to get rid of all those things that separate us from the other person so that we can just be human to human and be as close to them in every way as possible. And now it feels like we're putting up more barriers.
Chaplains have to get creative on connecting families. Letters, drawings, and FaceTime calls are lifelines for patients. Piedmont Fayette does allow one visitor if possible during a patient's final moments, and with proper PPE. But that means some loved ones are left out.
So they don't get to say those goodbyes. They don't get to sit next to them and hold their hand for as long as they need. And that's been heart-wrenching.
Missing out on a proper goodbye. In Fayetteville, Brittany Edney, CBS 46 News.